My dear students, hello. So today we'll be talking about somatoform disorders. So the objectives of this presentation is we will look at the clinical manifestations of each of the somatic symptom disorders. I want to clarify the name for somatoform disorders was changed to somatic symptom disorders. We'll also apply the nursing process to individuals with somatic symptom disorders, and we will evaluate the importance of assessing the patient's coping skills and strengths. So what is somatic symptom or somatoform disorder? So it's a disorder where a patient undergoes a great deal of psychological distress, and this psychological distress leads them into severe physiological distress or a somatic symptom. When I say somatic, I mean physiological or bodily symptom. So if you look at the definition, it would say that it's a mental health condition that causes an individual to experience physical bodily symptoms, and it's as a result of psychological distress. So I'll give you an example. A patient who comes in with a complaint of shortness of breath, even though their symptoms might be very mild, but they get so anxious and they get so focused and so worried about their shortness of breath that they get shortness of breath secondary to anxiety. So do you see this vicious circle? Their shortness of breath may be mild, but because of their heightened anxiety and their just heightened exaggeration of symptoms of shortness of breath, their shortness of breath is exacerbated. So that would be a somatic symptom. A lot of times somatic symptoms are pain related, or there is some sort of fatigue. Even if the patients are mildly tired, but they will feel extreme fatigue and weakness. If they have mild pain symptoms, they will feel extreme pain symptoms. They will be just overly concerned and overly focused on it. And they will be just preoccupied with it all the time. And their suffering is actually authentic. They're not making it up. They actually do feel those symptoms. They're not faking them. But it's as a result of psychological distress that's causing a physiological symptom. And what ends up happening that these patients, they experience high level of functional impairment. They cannot perform their activities of daily living. Just imagine being in their shoes. And we'll talk about it later, how to effectively communicate with these patients and care for these patients. So we'll talk about our DSM-5 criteria. We have talked about our DSM-5, and there are certain criteria. One of them is that there is blown out of proportion and persistent thoughts about the seriousness of one's symptoms. Just like I said, they might be mild or not as severe as the perception of patient. And there is constantly high level of anxiety about health symptoms. And they spend so much time and energy just focusing on those symptoms that they cannot really carry on normal functions of life. And although only any of the somatic symptom could be continuously present, but the state of being somatic symptom is just still persistent, it would happen over 6 months. So these are the criteria for anyone to be diagnosed with somatic symptom disorder. Now, one of it, disorder that I would want to talk about is the reason I put over here in your PowerPoint hypochondria, because we know it commonly as hypochondria, but in 2013, the name for disorder was changed to illness anxiety disorder. Now raise your hand if you haven't found yourself Googling up any symptoms and thinking, okay, maybe I have this, maybe I have that. I think to some point or to some level, we've all been a little bit of hypochondriac. I have to admit, I have been. So what is actually illness anxiety disorder? We have preoccupation with having or acquiring a serious illness, and somatic symptoms are not present, or if they're present, they're only mild. And if there is a medical condition that's present or there's a risk that you might be susceptible to that condition, or if you have a family member who's been exposed to a medical condition, or someone you love around you, or someone you know has been diagnosed with that condition, you will just think, okay, I'm going to get it too. If they have it, I'm going to get it too. And the preoccupation is very excessive, and it's literally disproportionate. And there's a high level of anxiety about health, and the individual is easily alarmed about personal health status. And I want to give you an example. If you look at the current event of situation and what's happening due to COVID, don't tell me that if you have felt a little scratched throat or a little bit of cough or runny nose or muscle ache, you haven't ran or anticipated getting a COVID test done. We have all been through this. This global pandemic has impacted the psychological health of nearly everyone, and it has impacted us in one way or another. And we've all felt that way. Okay, the first thing that comes to our mind, did we get COVID? And we tend to seek answers, and we are looking up, searching the symptoms and when to seek help and when to get tested. So just think about being in this situation forever or living with it forever, how difficult it must be. Another disorder that I want to talk to you about is convergent disorder, and it is of neurological nature. Actually, the underlying etiology is not neurological. So there is no neurological disorder, but the symptoms exhibited are neurological type. So what happens to the patients is that they will have some kind of motor or sensory uh, dysfunctions, they will have hearing, and they will have vision problems. Sometimes they'll have paresthesia, which is numbness of your fingers or tingling or burning sensations. Sometimes they will have seizures. Even they would suffer from paralysis. But there's an interesting thing about convergent disorder, that emotional conflicts or stressors may be that high that they can be actually transferred to physical symptoms, and they may have physical basis. As a matter of fact, I was reading in your textbook that sometimes even in MRI, patients with convergent disorder, that extent of emotional stress or conflict has caused neurological symptoms eventually. So they end up being positive for those neurological symptoms that eventually show up on MRIs. So that's a very serious disorder. So how do we help those patients? First thing that I say, and I've said it before, when we deal with these patients with mental health, be empathetic. Imagine yourself being in their position. It is very difficult. And do not discredit them. Assess for their nature, location, and onset, characteristic, and duration of the symptom. Ask them, because they are authentic symptoms, they are not faking them. Even if they do not have any organic underlying cause, there is still authentic symptom. This is a very important thing to remember for somatic symptom disorders. Explore past history of adverse childhood events, because that can make patients susceptible to somatic symptom disorder. Identify symptoms of if they have any history of anxiety or depression or past trauma that could be contributing to somatic symptoms. Determine what kind of quality of life they have, if they have any social support, and what kind of coping skills they have. Do they turn to spirituality? If they need help, seek help or comfort. Sometimes you have to look a little bit outside the box and then try to explore if there are any secondary gains that patient might be seeking from those symptoms. And then screen if they are trying to use this disorder for misuse of prescribed medications and substance abuse. And assess for their psychological and their biological needs. And explore the patient's cognitive style and ability to communicate their feelings and needs. Now, let me ask you one more thing. How else can you help? What I want to tell you, the biggest problem for somatic symptom disorder is lack of knowledge and deficit. and patient education is very important. So health teaching and health promotion is very important. Patients who use somaticization as a way of coping with anxiety, they tend to be less educated than average. And teaching these patients basic information about bodily functions is often necessary. Even sometimes use pictures and charts, that those could be helpful. And it's very important to involve their family in the whole process because their knowledge may assist in health promotion for those patients.